What's up guys, how are you? Welcome back to my channel, and today guys I'm back with serious stuff. Look at how I'm dressed. Today we're not doing all those never have I ever's and stuff. Today I'm back and I'm serious. You've been asking me like, hey, did you stop creating medical content? And guys, I told you I'm just going to mix. Yeah, so 1 minute you'll be seeing me I'm serious, the next minute we'll be laughing. So today I'm going to talk about COVID vaccines. And guys, let me tell you, I received my first dose in 24th March and my second dose was scheduled for 16th June. This is a 12-week period. As you all know, we have the AstraZeneca vaccine in Kenya, and there's a window period of 12 weeks, 8 to 12 weeks, within which you're supposed to have taken your first and your second dose. So getting my second dose was really a hassle, and let me tell you guys, it was too much of a hassle. It's like a story time. So what happened is I received the message, and at that time Kenya had very few vaccines, so I had to hop from one place to another in search of a second COVID vaccine. And guys, this was serious because I actually, the first time I went to Mbagathi, because the nurse told me to go to Mbagathi, I went there. The nurse told me we have 350 doses and they're already allocated to people. And Makiu, I'm a healthcare worker. According to the guidelines, they're supposed to give healthcare workers a priority. So I got there and then I'm told like, yeah, we've already given out numbers, so there's no way we are gonna give you the doses. Fine. I'm like, okay, let me proceed to the next place. So I proceed to Afya Annex. Then I got there, I'm told vaccines are over, there's nothing I can do, come back on Monday. So I proceed and I go back on Monday. On Monday we're saying no vaccines. So I'm left wondering, first of all, you're a healthcare worker, you're at risk of getting COVID much more than any other person, yeah, because of the interaction that you have with people. And then there you are, you're being told like, hey, you cannot be given these vaccines are not there, there's nothing we can do. So fast forward, they tell us to, on Afya Annex, they tell us to come back on Monday. So yeah, I go back on Monday, and going back on Monday to Afya Annex, I'm told, because that is the Monday where the vaccines had just come. The vaccines had landed in the country, I think, on a Friday. Then they told us like, yo, come back on Monday. So Monday, I ask again permission from work, like I'm going to get the jab. So I got there on Monday. By 7, Makiu, by 7 I was always there and I could get a line of people. So I got there, we stayed there for about 1.5 hours. Then you're told like, hey, no vaccines, they've not yet been brought here, so come back another day. So guys, see the frustration I went through. And Makiu, I'm a healthcare worker. So fast forward, I went back to Afya Annex the next day, and I was told like they've given a list of places where you're supposed to go get the vaccine. So I took a screenshot of the place and I decided like, yo, because the first time I got in Aga Khan, the next time I'm going to Aga Khan. So I proceed to Aga Khan, and going to Aga Khan, guys, you know what I'm told? We are only, apparently they were only vaccinating their staff. So tell me, I'm no staff of Aga Khan, I'm a healthcare worker, I don't even know where to get my job. Anyway, at the end of the day, I still got my job. That is like past the 12-week window, so I don't know whether it will be effective or not, crossing my fingers. Anyway, those are some of the challenges as Kenya we are going through, and I just like to urge anyone in the government, like, please, let's stop playing with people's lives. Like, yo, COVID is real, we need vaccines so that people can be actually immunized against it, so that we don't lose any people, so that actually there's stuff out there that's happening. So if you're in the government, or if you're in Ministry of Health, I kindly urge you to put Kenyans' interest at heart. Guys, do you agree with me on this? I know most of you have actually hustled to get the second dose of the vaccine, and most people are coming to my inbox like, hey, where can I get the job? Where can I get the job? And it's so sad. As Kenyans, I feel like Ministry of Health, you can really do better than that. Fast forward, so I've got the vaccine, and then, yeah, side effects came here and there. I can tell you some of the side effects that I experienced, and I did my first video when I got the first dose. I'll link it up here so that you can go watch. So I can proudly say that the second vaccine was far much better in terms of side effects. The only side effect I had was pain on the injection site. just a slight headache and a very slight fever, not compared to the first one. At least this one, within 2 to 3 days I was okay, and then there's just the general feeling of being tired, but that is now good. Fast forward, it's like 1 week now down the line, and yeah, I hope that now I'm gonna be able to be fully immunized against it. And which brings me to some of the questions that you guys have been asking me, so I'll just show my phone and then we start. So the first question that I've been asked is, how long does one take to be immunized against the vaccine? So there's usually vaccination and immunization. There's a difference between the two. So vaccination is just the act of you being injected the vaccine. That is vaccination. Then immunization, this is whereby now your body builds antibodies against the COVID virus from the vaccine that you've been given. So for COVID, you usually take like 2 weeks after your final dose. That's when I can say you're fully immunized. So for me right now, I'm 1 week, so I'm not even like fully immunized yet. So if you've received the Johnson & Johnson, Pfizer, Moderna, 2 weeks after your final dose, you're fully immunized. For Johnson & Johnson, it's 2 weeks after your first jab, because for Johnson they only give 1 jab, so that's it. Then next, can a fully vaccinated person get COVID? Yes, there's a slight chance that you can get COVID. So this also applies to other diseases. Yeah, you're immunized and then you can get the disease. But the advantage is this, that you're, even if you get COVID, it will not be severe. The purpose of this vaccine is just to prevent hospitalization and death. But you can get COVID, but you might be asymptomatic, and you might not even like realize that you have COVID or the symptoms. If you get it, then the symptoms might be very mild, just like a normal flu. So you can see the advantage of the vaccine. Next question, someone actually asked me this, and I would like to also ask you this so that you can go and do more research. Can you mix like 2 vaccines? Okay, so I've seen in some countries whereby maybe, for example, in Kenya, where we had the shortage of the AstraZeneca vaccine, some people or some countries are doing this. So if there's the shortage of the AstraZeneca vaccine, then they can give you either Moderna or Pfizer or another vaccine. So I've seen studies being done in Spain, in UK, and US. I'll link them down below about the mixing of the vaccines. Apparently they say, one, the reason why they're mixing is because of the shortages of the vaccines. You know, the way the Delta COVID variant has been in India, and it's really affected so many people, so that is why they're mixing. Then the other reason why they're mixing, they're saying, according to the studies, you build a stronger immune system, according to the studies that I've read. But WHO has not really published that, and it's still like they're still ongoing studies. So there's a probability that it will be there, then there's a probability that it will not be there, because COVID is relatively new and there's so much information every other time. But if I get like full updates, I'll be able to come up with another video and update you on mixing of vaccines and how to go about that. But according to the studies that I've seen, they're like, if you mix the vaccines, you're getting a much stronger immune response. And I've seen when they're doing clinical trials for the malaria vaccine and the Ebola, even HIV, they've been trying to mix different types of vaccines for the same disease, and then they see a stronger immune response. So let's hope that if you mix the vaccine, then you'll be able to actually come up with a better immune system compared to having 2 doses of the same vaccine. I'll continue updating you once I get more information about that. Then another question is, someone asked me like, how do I report the side effects that I have like gotten from the COVID vaccine? So there's something called PVERS. I'll take you through how you can report COVID side effects, and this portal is for pharmacovigilance, and anyone can access this portal, and you can just fill the side effects following immunization, that is called IFE, and side effects are following maybe any other drug that you might have actually taken and it's caused side effects. So I'm just going to do a little demonstration. I'll insert here so that you can actually know how to report your side effects. So as I was saying, I'm going to show you how to report adverse effects following immunization. So let's do this. So you just go to Google, then you type pharmacovigilance, pharmacovigilance electronic reporting. So it brings you to the home page. Then you just choose the one that says Pharmacy and Poisons Board. So you just click on it. Once you click on it, it will bring you to this page. You have the home, about, report, summaries, FAQs, and contact us. So you can see this is a form for reporting adverse events following immunization. We can just scroll through the page and you see you have the login, reporting by public or patients, guidelines on safety reporting, FAQs, safety alerts, who can report and what you can report on. So if you've got time, you can just Google this site and go through it, then you'll see what it says. So fast forward to the agenda of today. Let's look at how you actually report the adverse events following immunization, especially right now that people are being immunized against COVID and also any other drug that you might be on, and then it causes like adverse effects. We always advise that you report the effects. So this is how. So you just come to report. Then you see it says this is meant for members of the public and patients to report drug adverse reactions, adverse events following immunization, incidences and stuff. So you just come to this and you fill all the information. So since I'm the one who's doing this, I'll just use my credentials. So name of the reporting person, I'll just write my names on the site. Then the relation, we have self, parent, guardian or other. So since I'm reporting on my behalf itself. Then email address, I'll just type my email address. Then the county, it's Nairobi. So if you're in another county, you just go to the drop down menu and you select your county. Then mobile number, it's not starred, so it's not really required. Then you come to the patient's name, so initials. So you can be reporting on behalf of someone else or you can be reporting for yourself. So the patient's initials, I'll just use my initials. Then female. Then date of birth. You can either select the date of birth or the age group. So for date of birth, I'll put my date of birth. Or you can select, if you select the age group, adult, neonate, infant, adolescent or elderly, then you proceed. Then select the type of report. So if it's an adverse drug reaction or a poor quality medicine, so I'll select adverse drug reaction. Then it brings you to a drop down menu. So side effects, select all side effects experienced. So you just select, like for me, I can say I had headache, I had joint and muscle pain following the COVID vaccination. Then other side effects, I'll just put maybe fever, malaise, and anything, any side effect that you might have experienced, you type it there. Then when did the reaction start? So I'll just like select a random month, but you select the day in which you started like actually having the side effects. Then is the reaction still on? If you're still experiencing the side effect, yes. If not, no. So for me, I'll say no because I'm already done with the side effects. Then name of the device or the vaccine. So I'll just say it's the AstraZeneca COVID vaccine. Then the manufacturer, you put it. If you're not sure, you just leave it. Then when did you start taking the medicine, just input the date. So I'll put June, maybe 18th or something, just put your date. Then when did you stop, I'll select the same date. So June, the same date. Then expiry date, if you know the expiry date, you can put it. If you don't know, just leave it. Then where did you buy? I'll just put the center of vaccination. Then for additional medicines or devices, you click add. If you're on any other medicines, maybe you can add those medicines and the medicines that are giving you the side effects. Then if you have pictures, you can click add. If you don't, then just click this window and leave it. So please solve the riddle. 6 plus 0 is 6. Then after that, now you click on submit the report. So I won't submit because I already submitted the report already. So that's just it. After that, you just submit. So this will just actually help us to get information on how Kenyans or how Africans are reacting to the vaccines, because you know clinical trials are not like done on Africans, so it's important. And thank you. So still on this page we have healthcare workers. So if you're a healthcare worker, you just click on the login page, then it will bring you to this page, then you just put your credentials. So I'll log in with my credentials. So if you're a healthcare professional, this is for you. Then you input the password. If you don't have like an account, you can just click on register, then you register, then create an account. So once you log in, I won't have the password. So once you log in, it will bring you to this page where you can actually view all the reports that people have actually submitted. And you can also view the reports that you've submitted for poor quality medicines, adverse drug reactions, adverse events following immunization, anything on medication errors, transfusion reactions, and everything. So this is how you go about it as a healthcare worker. Maybe it's a patient who's come to you and then they've experienced an adverse effect, or you're monitoring a patient and they've experienced an adverse effect. So this is how you go about filling it. So you just come and fill all this information. You click on new EFI. So it will bring you this form, the EFI reporting form, then the institution name. You just type the name of the institution. If it's a hospital or something of the sort, you just type. So I registered with my institution, that's why it's showing up there. Then the county and everything. So you just fill the details of the patient. Let's just scroll down, name of the guardian, all these details you just fill in, type of vaccination service, all these details. Then you just come down here and then you click on the side effects. Then you can describe the EFI, and then after that you can describe the details of the event. Maybe patient on day 1 was given this vaccine, they experienced this and stuff, including the time of occurrence. So you can get this information from maybe the nurse or someone who administered the vaccine to them. Then coming here, we have suspected vaccine or vaccines. So you can get the name of the vaccine, the dose, the indicated time. So you just come and click on add. So name of the vaccine, let's check if they have put the COVID vaccine. Yes, the Covishield. Then the dose, if it's the first or the second dose. So I'll use the second dose. Then date and time of vaccination. Let's just say it was 18th June. Then the route, it was intramuscular. Site of vaccination, you can say the left arm. Then the batch number, you input the manufacturer, the expiry and everything, all of it. Then past medical history, you're supposed to take the history of the patient. Then here we rate the adverse effects. Were they serious? Yes or no? If yes, then you say the effect on the patient. Then the action taken, like did you give the patient an analgesics in case of fever or pain? Did you give them antipyretics, analgesics, or something of the sort? Then the outcome, did the patient recover? Was it fatal? Not recovered, or is the patient still recovering, or something of the sort? Then if you collected any specimen for further investigation, then name of the person reporting, the designation, the phone number, the date. Then if it's the same person who's reporting or submitting the report different, you add. If it's different, then you add the designation and everything, the name, everything. You just input all this information and then you save the changes. After saving the changes, then you can submit the report. You can save changes and come and actually edit the report later, but once you submit, you cannot be able to edit it. So yeah, I hope this will help the healthcare worker and the patient to actually know how to report these adverse events. In case of any questions, please let me know. I'll be able to answer you. Thank you. It's important that, guys, you should go and report, even if it's a headache, even if it's fever, even if it's joint pain. Make sure you go and report the side effects on that site, because we will be able to get data as how data on how like Africans we are reacting on the vaccine, if there's some people who are dying, if there's some people who are developing like allergies. If you have been given your vaccine, either the first or the second dose, I kindly urge you to go to this portal, just check it out and go and actually report the side effects that you've experienced. So guys, I hope this video has been able to help you. If you have any other questions relating to COVID vaccines, let me know in the comment section, and if you want me to talk about any health related topic, guys, I'm here for you. Even any topic that you just, anything random, let me know in the comment section and we'll be able to talk and assist each other. I'll see you on my next video. Bye bye.